Russ, good to see you. Have a seat. Good to see you again. How can I help you?
I'm here to have my STI checkup.
Yeah, well, it's important that you have your STI screening yearly and more often if you have a new partner.
Yeah, my sister said I should have it done at least every year. She also recommended I use condoms.
Yeah, look, that's really good advice because we test for chlamydia, gonorrhea and syphilis, and your risk of infection goes up if you're having unprotected sex or if you're not using condoms. So look, we'll go over the STI and BBV flip chart for more information. The test is easy and we test for chlamydia, gonorrhea and trichomonas in a wee test, but we also do syphilis and HIV by taking your blood, and we usually get the results back in about a week.
Okay, what's the next step then?
The checkup Sexually Transmitted Infections recall can be set to appear in the clinical records for patients aged 16 to 35 at the start of a community screening period. Using the checkup Sexually Transmitted Infections clinical item can help you remember what needs to be done in the consultation. It can also be searched for and used for reporting.
These tests are important because not everyone has pain or symptoms like discharge. Finding out that you have infections early on can prevent a lot of health complications later on in your life, and most infections are easy to test and easy to treat for.
My auntie works here. Are you sure my results are private?
Yeah, all your information is private. We're bound by client confidentiality, and only people in your care plan will know about your information. So people like doctors and nurses might also have to have a look at that information as well.
Ensure that you follow the privacy policy in your health service. Under the South Australian Public Health Act 2011, it is mandatory for the doctor to notify SA Health if gonorrhea, syphilis, HIV and/or hepatitis B are detected. Notification by the doctor for chlamydia positivity is usually only required if the patient is less than 16 years old. SA Health does receive the positive lab results for these STIs.
What happens if I do have an infection?
If the test shows that you have an infection, there's medicine to treat that, so that's not a problem. It is important that the people that you may have had sex with also get tested and treated too, so we can support you to tell those or notify those people to come in to get those tests, and we can do that without using your name. We keep your results private, as I said before. Some of the results may need to be given to the health department, and that's just so they can keep count of how many infections are getting around in the communities as well. They will also keep your information private. For HIV and syphilis though, there is a period of time that the infection might not show up yet, and we recommend a test now, but we also recommend a follow-up test in about probably 3 months, and after the last time you might have been exposed. So before you leave today, please book an appointment and make sure that we have the right contact details on file to discuss the results in about a week. So do I have your consent to proceed with STI tests?
Yes.
After receiving consent, you can use the .sti text shortcut to document informed consent in the client's progress notes. Just type *STI and enter. Then you can edit the text that is generated. Double-click on the Checkup Sexually Transmitted Infections recall and click on Complete It. It can help to have resources like the AHCSA Screening Flowchart, CARPA Standard Treatment Manual for Men or Women's Business Manual if your service uses these, and information about STIs that you can show patients. The Standard Treatment Manual includes the standard STI check for men, which can be referred to for screening. The Women's Business Manual also includes a standard STI check. Always refer to the most recent edition. Check with the patient about previous sexual health checkups, past STI test results, and if they're experiencing any current symptoms.
Is it okay if I can ask you some questions about your sexual health? Awesome. Have you ever had a sexual health test before?
No.
You haven't. Okay. So we check with clients if they have any symptoms such as pain when urinating, maybe abdominal pain or discharge. Do you have any of those?
No, I don't have any of those.
If a patient is experiencing symptoms, they will need a full STI checkup. Refer to the CARPA Standard Treatment Manual or CARPA Women's Business Manual for the relevant protocols for each symptom. Although the patient will still need testing, it's important that the right treatment is started straight away.
Do you know if you had a blood test to see if you're protected from hepatitis B?
I don't know.
You haven't? All right. So I'll just check the record here. And it says on a previous STI test that, well, in fact, it's a result from a year ago. It actually says that you're immune to hepatitis B. So that's good.
Oh, okay, thanks.
If it's been about a half an hour since you did a wee, then you can go to the toilet now and get your first catch urine in the specimen cup.
Yeah, sure. I haven't gone since before I left home, so it's all good.
All right, no worries. Well, look, if I can get you to just wee in this cup and probably get about that much.
Okay, thanks.
Explain to the patient that it is important to attend their follow-up appointment in 1 week to go through the test results and yarn about any other worries or questions. If the test results are positive for STIs, treatment and partner notification need to be discussed. Confirm the correct contact details with the patient. Check your service's protocols for booking follow-up appointments.
So what happens when I come back in a week?
Yeah, look, so we'll talk about the results when you come back into the health service. If medicine is needed, then we'll show you the options and the next steps for that. So we'll support you the whole way. We just got to make sure that your contact details and your address is correct before you leave.
Okay.
Would you like more information on STIs? We got a lot of stuff online, but we can also give you some of these brochures so you can take some stuff with you before you go.
I'm fine with the brochures, thanks.
Thank you for coming in to get your STI screening. Sexual health is a big part of your overall well-being and holistic health. So before you go, take some of these condoms because they'll protect you from STIs.
Thanks for your help, Russ.